Hi, Sarah. How are you?
Doing great. Nice to meet you.
Nice to meet you. Thank you for joining us at New Beauty. And I know you've been a patient of Dr. Tess Mauricio for quite a number of years. So I'd love to hear your experience on just how you've been treating aging since your 40s.
Well, I found a mole on my body and I thought, my God, I need to have that checked out. So I walked in. Dr. Tess was just starting up her practice. So I am proud to say it was her first patient. She was great. And I felt an immediate connection to her.
You mentioned that you have been a patient with Dr. Mauricio since you were 49. What were some of your concerns that brought you in?
Well, I wanted to address, first of all, the aging process. I was going into my 50s and thinking, oh, I've looked this way or been fresh and, just been agelessly living my life. And then I was a little bit concerned about sagging or in the cheek area or lines around my lips. And I've always been really, complimented on my eyes. And I didn't want to lose that look of young eyes. So Dr. Tess and I really sat down. She was so open, so caring, and said, let's work on a few things at a time. And we started out, we did time machine procedure.
What treatments did you see made the biggest difference? And then what treatments did you stick to for years over years? Because now we're talking about almost 2 decades, right?
Yes, really. And I couldn't feel better about myself because in 2 months, I'll be 70 years old. I can't even
Wow.
believe it. I was concerned about lip lines and I wanted that fullness in my lips that I had been born with and the look in my eyes of young eyes, because like I said, people have always said your eyes are beautiful. And I didn't want to lose that spark and the young look in my eyes. So I did have with Dr. Tess, like I said, her time machine procedure. We did Jeuveau, which I absolutely love. It is a lifting and a tightening. I've had the fillers that were done around my lip and lifted up the cheek area. And the jawline, which has been wonderful. I love the fact that when she does do Jeuveau, even in the corners of your eyes, it gives you a lift and the confidence boost. I can't say any more about it, how wonderful it's been. I also wanted to talk about V confidence, which has been miraculous. And that is where Dr. Tess, for any leakage that women start exhibiting or having, what a wonderful thing. And Dr. Tess was so caring and really takes you through the procedure where it's absolutely painless. Maybe a little bit of pressure, but the rewards afterwards, I can't understand why every woman doesn't stand in line to have that done. It's life-changing.
What is the name of the procedure? And this is
It's
feminine.
V confidence.
V confidence. And this
V
is
confidence.
for feminine wellness, right?
Yes, for feminine wellness. Yes.
And when did you start that?
I had that done, I would say 2 years ago. I was so blessed. Dr. Tess had just started doing that. And you talk about synchronicity. The synchronicity in that was I had a cold and I coughed and I went, what was that? I had just a tiny bit get started because like I said, I'm a cancer survivor. I had thyroid cancer, but also I had a hysterectomy, which drops the bladder, because you have no more holding of your uterus. So at the same time that happened, Dr. Tess called me up to come in and have that done. And if that wasn't a blessing, I don't know what else was, but I am just in awe of how life-changing Dr. Tess is.
What a testimony. And, a lot of people shy away from talking about procedures like that or treatments like that. So I think that's great that you want to share the information with other people and how it's helped you.
Well, when I could tell you some funny things, when my husband and I go out, and I know I'm testimony that I don't look like I've had anything done. I am not overworked, overfilled, pulled tight, surgery, nothing.
You look great.
I am honored to walk around and be a true testimony for her. My husband, he's 73. We'll be out with people and they'll say, Michael, you robbed the cradle. And when I tell them my age, they fall off their chair. I can't believe it. And, that's uplifting and it makes me feel so good.
That is so sweet. And you look amazing. And I'm sure you
Thank you.
feel amazing, which is
I
really
feel
what is
amazing.
so important. Do you think anything has changed drastically from your 40s to your 70s? Do you have a different approach entirely?
Oh, yes, that's what I said. There's a psychological complexity. It is not just walking in. And where Dr. Tess is very, very intelligent, not only is she artistic, I think one of the things she wanted to be was a psychologist. And that's evident and it shows in her practice. Because when you walk in and you are there as a patient, you want your doctor to know who you are. And she has done that with me. But I think every woman should venture into it because the psychological aspect of it is wonderful. And I don't get when people, they don't. And I'm trying to understand it, but I also will not back away from how I feel and the procedures I've had done because I'm trying to make women understand how it makes you feel. And if you're a working woman, please go into, Dr. Tess or have a, confidence and an uplift about where you start maybe, look, me 68 years old, I'm just starting my life. So, and, not in where I've been stagnant my whole life, but I feel the best I have ever been in my whole life. I really do at the present. And I'm proud to say, I'm 70 years old, and I always say to Dr. Tess, I hope, God willing, I'll be around till I'm 90 with her by my side.
She will definitely help you look 20 years younger even then. So,
Yeah, I can't wait.
often would you say, like, how much of a commitment, having done this for 20 years and having an anti-aging plan led by a professional, how often would you say you were in Dr. Tess's office over the years? How much of a commitment is it?
I don't think it's a commitment to where you're hooked in monetarily or psychologically, because I think that's a big problem with people that think they have to keep going in and going in. And, this is where you get in the trouble of overfilled, over tightened. It's not a commitment where you feel like you have to be there. You go as you feel the need to be there and how you want to feel and how it makes you feel. But you always know you're never going to walk out of there looking any worse for the wear or like I said, overfilled, overworked. You just look yourself only better and rested. And the proof's in the pudding. Look at Dr. Tess herself.
She looks amazing, and so do
Yes.
you. So I always
Thank
say
you.
I'll have what she's having.
That's what I was going to say. That's perfect.
And what advice would you have for someone who is just getting started and they want to age gracefully, but they're just not sure where to start?
Start with what is bothering you. Don't walk in. Dr. Tess cannot fix everything. If it's psychological, she'll work with you in what you feel is bothering you. Because we all have a version of ourselves that we want to be, but she's smart enough to know that we can't be over the top, like I said, which leads to most dermatologists or plastic surgeon really overworking a patient. Dr. Tess doesn't do that. And my advice is if you want to have a spring in your step, which I do, you want to feel fabulous, you want to feel vibrant, I would tell women, please start at one thing. If it's your lips, start with a little bit of filler. If it's your eyes or you want, or your wrinkles, start with Jeuveau. If it's totally incontinence, oh my God, really start with that because I hear so many women that are so distressed about that. And you've got Dr. Tess who's willing to help you, and it does work. I'm living proof of it with countless others.
Wonderful. Well, thank you so much, Sarah, for speaking with us
you're
today. We're going to have a little chat with Dr. Tess also. But thank you again. And
so welcome.
I can only hope to look like you when I'm
Thank you.
turning
I'm
70.
so honored to speak on behalf of her. She is the greatest, and I'm living proof of it. So thank you.
Thank you so much. Hi, Dr. Tess. How are you?
Hi, Tatiana. I'm doing great. Thanks for having us.
Thank you for coming and speaking with New Beauty. And I always love talking to you. As I was saying to Sarah, I'll do whatever you say because you always look amazing, but more importantly, you give the best advice. So thank you so much for coming and speaking to us.
No, I look forward to our conversation.
So Sarah looks incredible, and she's really, like I said, a testament to trusting your doctor, having a long-term plan. What is your philosophy on aging in general, and how is it that you're helping your patients achieve these long-term goals like Sarah?
So, Tatiana, we just celebrated our 20th anniversary, and Sarah was one of my very first patients. She walked in our office when she was 49, and believe it or not, she said, she's going to be 70. So we kind of been together. This is a long-term relationship that we've had. And for me, aging is really about like feeling your very best, being your very best at any age. And that's what we promise at M Beauty for every single patient is that, we will utilize the latest, most cutting edge technologies, but the end goal is really so that they can be their best. And so that was my promise to Sarah when she was 49. And this is continuing to be my promise to her now that she's going to be 70.
Sarah mentioned some treatments that she's undergone over the years. What are those specific treatments that you use that are key to maintaining your appearance over time?
Well, we pioneer a lot of the regenerative medicine, regenerative aesthetics treatments. And I know she mentioned the time machine procedure. This is our trademark signature combination protocol, which combines the latest energy-based treatment. And that could be a laser. She's had laser. She's had radiofrequency microneedling. We then combine that with regenerative products like platelet-rich plasma, exosomes, and then the goal of it is, of course, turning back the hands of time. That's why we call it the time machine procedure.
Right.
Naturally rebuilding collagen, naturally regenerating. And so my patients end up looking completely natural, just the youthful, fresher version of themselves.
And so, how do you balance those treatments with at home care over time?
So it's very important that they all go together. And I am a big believer in optimization and combination protocols. Actually, the time machine procedure is one of the first combination protocols that was introduced in our field. And I'm really proud to have pioneered that. And so we create combination protocols in our practice. And with Sarah, we did the time machine procedure, but we also combined it with your, neuromodulators. She's had Botox. She loves Jeuveau. We've done a little bit of hyaluronic acid gel filler, just very, very natural looking. And that is my philosophy, is that the treatments that we do should be invisible. It really should be undetectable. And, skincare products have really, so amazing now. We have exosomes, topical. Obviously, we have incredible antioxidants. We have multitasking skincare products that we recommend to our patients that one, prep their skin for the treatments and two, optimize their results.
And I think it's really important to have the right person guiding you, right? Because there's so many options out there right now. You can go to the beauty counter, you can go to Sephora, you can go to a med spa, but having one person that can sort of synthesize everything for you is super important, right?
Yes, absolutely. So we offer free consultations. It's about education and it's about creating awareness, especially in our practice where we're about 5 years ahead, especially with all these regenerative therapies. But, it's really listening to our patients and customizing the plan for them and educating them on treatments that they may never have thought about, they've never have heard about. And in our practice, they are every single consultation, free consultation, the photos go to me directly, Tatiana. I look at them and I personally create that treatment plan and then they'll get a quote. And so it's all about education. There's no pressure. It's really, I encourage everyone to take advantage of that and get educated.
Okay, you mentioned treatments that maybe you hadn't thought of as you're aging. And one of the things that Sarah mentioned is problems with incontinence and feminine wellness. And we don't really talk about that a lot. We talk about lasers, we talk about chemical peels and injectables, but this is a part of aging. So, what can you tell me about the V Confidence treatment and why that was a good one for Sarah?
Yes. So, as one of the first doctors to actually introduce platelet rich plasma in combination for skin therapy. And so then, Dr. Charles Reynolds, who is the inventor of Vampire Facelift and also the O shot, personally, talked to me and said, Tess, we need you to help pioneer this because the same patients that are wanting rejuvenation for their skin are also the same patients who may be starting to have issues with urinary stress, incontinence, dryness, pain. And so that is what we found. And platelet rich plasma injected in the areas around the urethra, in the vaginal area, has been life changing. And so Sarah, because she's in the right practice, and I've talked to her about that. She opened up about that issue about incontinence. I offered her the treatment. We did it, and it was amazing for her.
Wonderful. Are there any other new or innovative treatments that people should be looking into or that you really recommend?
Well, I think hair restoration is having a big moment. I was just speaking at the Aesthetic Tech Forum, and I was in the panel for hair. And just like what we've created for the skin combination protocols, at NewBeauty Clinic, we are creating combination protocols combining lasers, platelet-rich plasma, exosomes, nutritional supplementation to really help men and women, really address hair thinning, hair loss that will happen with the aging process. And I am also, again, I practice what I preach, Tatiana. And Sarah loves that. I've had the time machine. I've had the O shot. I've also treated my hair. This is all mine. There's no extensions here. I'm a big believer in being proactive. And if there's one thing that I've learned in 20 years of practicing is that, if we really are proactive and not wait until there is a lot of sagging, wrinkling, hair loss, we really can make a huge difference. And these regenerative therapies can work miracles.
I think the time machine is such a perfect name because you look like you're 20 years old. So
Thank
if
you.
you said, come and do this and you'll stave off aging for a while, I would 100% follow you.
Thank you. And I just want to give Sarah a shout out because, she makes incredible jewelry. And this is one of her pieces here. And she's also psychic. She knew that I would be wearing an ombre color here, and it totally matched. And we didn't talk about it at all. As far as
Beautiful. I love it. Well, thank you again, Dr. Tess. I really appreciate your time and your expertise, and of course, Sarah's. And, if anyone is on the fence about starting an anti-aging plan, I would say this conversation can really help kind of push them.
One last story, Tatiana, about that. I have an 82-year-old patient who has never had any aesthetic procedure done because she said she was a feminist and she believed that women should age naturally. She came to me because she had Mohs surgery. There was a bad scar and I was working on it. And then I talked to her and I told her about some laser treatments on her skin and she loved it. And she had this boost and she said that she was wrong. And that she wants all the younger women out there to know that these treatments are not for vanity. It is for self-confidence, self-esteem, and it's for your spirit. And so absolutely encourage everyone to try it. And you don't have to do major things, but it's really beyond vanity. And my tagline is, it's not about vanity. It's about loving yourself and the skin that you're in.
Absolutely. I agree. I think it's just another form of self-care, like getting your hair and your nails done or going to the therapist. It's vital. So as long as you're going to the right person.
That's right. Exactly. That's the key.
Thank you so much, Dr. Tess. I appreciate you.
Thank you, Tatiana.
Until next time. Thank you.
Okay. Bye-bye.